Good evening viewers. In this session I shall be talking on behavior modification, myself Pramila Singh from Pandit Ravi Shankar Shukla University. Behavior modification refers to the technique or treatment procedure used to change behavior by altering a person's current environment to help the person function better in everyday life. Behavior modification basically focuses on using a principles of learning and cognition to understand and change people's behavior. It means behavior modification is a psychotherapeutic intervention used to eliminate or reduce maladaptive behavior in children or adults. Some therapies focus on changing thought processes that can affect behavior. For example, cognitive behavioral therapy. Behavior modification focuses on changing specific behaviors with little consideration of a person's thoughts or feelings. The goal of behavior modification is to reduce or eliminate undesirable behaviors and teach or increase acceptable behaviors. This is accomplished through the use of behavioral techniques and strategies such as systematic desensitization, modeling, reinforcement and aversive conditioning. On the other hand, cognitive theories grew from the concern that behavior involves more than an environmental stimulus and a response. It may be voluntary or reflexive. These theories are concerned with the influence of thinking about and remembering experiences or behavior. Cognitive theories also focus on the organism as an active processor of information that modifies new experiences, relates them to past experiences and organizes these information for storage and retrieval. Behavior modification relies on the concept of conditioning, which is a form of learning. And there are two major types of conditioning, classical conditioning and operant conditioning, as we all know about it. Classical conditioning relies on a particular stimulus or signal. An example of this would be if a family member came to the kitchen every time you baked cookies because of the delicious smell. The second type is known as an operant conditioning, which involves using a system of rewards and or punishment. Dog trainers use this technique all the time when they reward a dog with a special treat after they obeyed a command. Behavior modification was developed from these theories because they supported the idea that just as behaviors can be learned, they also can be unlearned. As a result, many different techniques were developed to either assist in eliciting a behavior or stopping it. This is how behavior modification was formed. Behavior modification is a means of changing behavior through various techniques used to replace undesirable behavior with desirable ones. Behavior modification techniques have been used to treat both adults and children for various problems such as bedwetting, separation and general anxiety, various phobias, obsessive compulsive disorders, etc. The method used varies, but usually involves some form of positive or negative reinforcement. This concept had its beginning in 1938 when B.F. Skinner published his book The Behaviour of Organisms, setting forth the principles of operant conditioning, that behavior could be shaped by reinforcement or the lack of reinforcement. There are a number of techniques, and the purpose behind behavior modification is not to understand why or how a particular behavior started. Instead, it only focuses on changing the behavior, and there are various different methods used to accomplish it. These may include positive reinforcement, negative reinforcement, punishment, flooding, systematic desensitization, aversion therapy, extension, etc., etc. Now, let us take one by one all these techniques. Positive reinforcement is pairing a positive stimulus to a behavior. A good example of this is when teacher rewards their students for getting a good grade and stickers. Positive reinforcement is often used in training the dogs, pairing a click with a good behavior, then rewarding with a treat is positive reinforcement. Negative reinforcement, on the other hand, is the opposite and is the pairing of a behavior to the removal of a negative stimulus. A child that throws a tantrum because he or she does not want to eat vegetables and has his or her vegetables taken away would be a good example. Punishment is designed to weaken behaviors by pairing an unpleasant stimulus to a behavior. Receiving a detention for bad behavior is good example of punishment. Then there is another technique called it flooding, which involves exposing people to fear invoking objects or situations intensely and rapidly. Forcing someone with the fear of snakes to hold one for 10 minutes would be an example of flooding. Then a technique which is commonly used for phobias and other problems, that is systematic desensitization. A concept described by Wolpe uses a hierarchy like the examples above, but instead of applying reinforcement, the client is taught to relax. Some behaviors are incongruent with each other, and we have found that being tense, anxious and afraid is not possible when a person is relaxed. The theory argues that if we can teach a person to relax in the presence of a feared object or situation, then we can alleviate the associated fear. In systematic desensitization, an hierarchy is created, typically by the client alone or with the assistance of the behavioral therapist. Often the hierarchy includes imaginations such as imaging a spider crawling towards you or imaging a spider on your hand as intermediate steps. The goal of this treatment is the same as shaping and reinforcement, to eliminate the fear associated with the object or situation. In behavior modification, we apply these same technique in order to effect change on the way a person acts or responds to the environment. Changing complex behaviors hence requires complex behavior modifications. The concept of shaping comes into play here. Shaping reflects to the reinforcement of behaviors that approximate or come closer to the desired new behavior. The steps involved are often called successive approximations because they successively approximate or get closer and closer to the desired behavior. Now, let us come to some principles and approaches of behavior modification. Behaviorists develop different approaches and schedules for shaping behavior. Through imitation, schedules or routines, or by doing nothing at all, they were able to learn how we learn and change our behaviors. Modeling is one of the technique. This approach entails teaching an individual to emulate a certain behavior. As an example, modeling might occur in the employment industry when a new employee gets trained by a more experienced colleague. Cueing is another technique. Like the name suggests, cueing is reminding a person to perform a certain action at a given time. Discrimination technique, it teaches a person to behave in a certain way for a particular set of stimuli, but not for another. The reward or the reinforcement occurs only after the appropriate response has been given. Then substitution, when a current reinforcer no longer prompts the desired behavior, a substitution may occur in which a new reinforcer is presented. Satiation means letting a person tire of performing an undesirable behavior. In the case of addiction, this generally does not work, as the undesired action would be the administration of the drug or alcohol. Avoidance means teaching a person to avoid an unpleasant situation. Then fear reduction technique can be very helpful managing phobias. It works in such a way that a person is incrementally exposed to a stimulus that may induce fear at first, but eventually the idea is that the individual will grow comfortable or more relaxed in the presence of the once feared stimulus. In addition to these, behavior modification techniques can also work on schedules or intervals in such that certain responses are shaped to occur at different times, or that particular reinforcers or punishments may be administered at varying intervals in order to alter behavior. It should be noted that not all behavior modification techniques will work with every individual, nor will every individual's behavior warrant singular approach. In some cases, a combination of techniques may prove to be beneficial. There are several schedules of reinforcement which can impact behavior. When a behavior plan is initially set up, continuous 2 is used to establish and reinforce the behavior. Once the behavior has been established, continuous reinforcement can change to intermittent reinforcement, which is termed thinning. There are 4 types of intermittent reinforcements, and they are fixed interval, where the person is reinforced by a set number of responses. Then variable interval, where the person is reinforced by a variable number of responses. Then fixed ratio, where the person is reinforced after a certain number of responses, and variable ratio, where the person is reinforced after a variable number of responses. That is, variable ratio intermittent reinforcement is the most effective schedule to reinforce a behavior. Now, let us take some examples. For instance, fixed interval, that is rewarding a person at the end of each day. Then variable interval is rewarding a person sometimes at the end of the day, sometimes at the end of the week, and sometimes every few days. Fixed ratio, that is rewarding a person after completing the desired behavior 4 times. Then variable ratio, rewarding a person after completing the desired behavior after 3 times, then after 6 times, then after 2 times, etc. Gambling is a real world example of a variable ratio of reinforcement. As we know, behavior modification is a leading treatment for obesity because it produces moderate, that is about 10% weight loss with minimal side effects. Obesity treatment has targeted various aspects of food intake and physical activity. However, the emergence of behavioral treatment in the 1960s marked a change in the way such modifications were approached. Behavioral treatment is based on principles of social learning theory that suggests that maladaptive behavior of eating and excessive behaviors are learned and can be unlearned through a series of techniques, and the basic components of treatment include self-monitoring, stimulus control, and cognitive restructuring. Well controlled studies on the short and long term effects of behavioral treatment indicate beneficial short term outcomes. However, long term maintenance of weight loss continues to be problematic. Sampling bias, poor measurement tools and a lack of assessment of health related outcomes limit the current state of research. Then one more component is important: behavior modification and psychosocial support. Researchers have shown that behavior modification and psychosocial support should be included in weight control program. That is to focus on methods of acquiring new behavior, not merely on descriptions of desired behaviors, but incorporate standard therapeutic modalities including self-monitoring and cognitive restructuring, and also providing guidelines for maintaining weight loss, such as resuming record keeping if weight is regained, practicing control intake of fear foods and utilizing family and social support system also. Patients attempting to modify their diets and physical activity patterns frequently require therapy for psychological and social problems. Keeping detailed records of dietary intake, exercises and emotional factors as an important aspects of weight control and approximately focuses attention on patterns and problems rather than on pounds or weight. An important aspect of behavioral support is to help the patient maintain a positive outlook and emphasize even small positive behavioral changes rather than setbacks. Outcome research provides support for the effectiveness of exposure desensitization for phobias and obsessive compulsive disorders. Behavioral and cognitive behavioral interventions have been shown effective for depression, manic attacks and agoraphobia, social phobia, tension headache, chronic pain and bulimia. Behavioral approaches to marital therapy have been effective, but seem to work best when combined with elements from other approaches. Finally, behavioral family interventions along with maintenance on neuroleptics have been shown to reduce relapse rates in schizophrenics. The psychology of behavior change is complex. Change does not happen overnight and it happens in stages. Prokaska has found that people who have successfully made positive change in their lives go through 5 specific stages, and these stages are pre-contemplation, contemplation, preparation, action and maintenance. Now, what is pre-contemplation? It is a stage at which there is no intention to change behavior in the foreseeable future. Many individuals in this stage are unaware or underaware of their problems, and some people even call this a phase of denial. Then comes the second stage, that is contemplation. And this is a stage in which people are aware that problem exists and are seriously thinking about overcoming it, but have not yet made a commitment to take action. Many people in this stage can be described as ambivalent. They want to improve their blood sugar, but are not yet ready to cut back on eating sweets. Then comes the preparation stage. And this stage can be considered the information gathering and planning stage. The preparation stage is the most important, and 50% of the people who attempt behavior change and skip this stage will relapse within 21 days, according to Prokaska in his book Changing for Good. Then comes action stage, which is the stage in which individuals modify their behavior, experiences, environment in order to overcome their problem. Action involves the most overt behavioral change and requires considerable commitment of time and energy. And during the action stage, one implements the plans developed and information gathered in the preparation stage. Then comes the stage maintenance, and it is a stage in which people work to prevent relapse and consolidate the gains attained during action. For addictive behavior, this stage extends from 6 months to an intermittent period past the initial action. We can see that within each stage, specific actions called processes of change help someone mentally move through each stage successfully. In the contemplation stage, the process of change are consciousness raising and self-revelation. Consciousness raising is the process of actively becoming more aware, mindful, or conscious of the current situation. Self-revelation flows naturally from consciousness raising, and self-revelation means taking stock of appraisal of the behavior that needs to be changed and reveals how your value conflict with the problem behaviors, how your values conflict with the problem behaviors. An activity which will help clarify your values or why you want to change is called decisional balance. And the decisional balance takes into consideration the pros and cons of behavior change. Understanding pros and cons helps one acknowledge that behavior change has good consequence, but requires some kind of sacrifice. Process of change are the covert or overt activities that people use to progress through the stages. Process of change provide important guides for intervention program, since the processes are the independent variables that people need to apply or be engaged in to move from stage to stage. 10 processes have received the most empirical support in our research to date, and these 10 processes are: first is process of change, they are experiential, and first is consciousness raising, increasing one's awareness. Recall information people had given me on how to stop smoking. This can be an example. Then second is dramatic relief, emotional arousal. I react emotionally to warnings about smoking cigarettes. Third is environmental revelation, that is social reappraisal, that is I consider the view that smoking can be harmful to the environment. Then social liberation, that is environmental opportunities. I find society changing in ways that makes it easier for the non-smoker. And self-revelation is self-reappraisal, that is my dependency on cigarette makes me feel disappointed in myself. Then second process of change is behavioral. First was experiential and second is behavioral, and it includes stimulus control, that is re-engineering. That means I remove things from my home that remind me of smoking. Then helping relationship, that is supporting one. I have someone who listens when I need to talk about my smoking. Then counter conditioning, that is substituting. I find that doing other things with my hands is a good substitute for smoking. Then reinforcement management, which is rewarding, means rewarding. I reward myself when I do not smoke. And self liberation, that is committing, and I make commitments not to smoke. So, these are the behavior patterns that can bring change in the behavior of the individual. Teachers can use behavior modification in their classroom to increase desirable students' behavior and decrease undesirable ones. Behavior modification is based on the idea that good behavior should lead to positive consequences and bad behavior should lead to negative consequences. When behavior modification is used consistently, students slowly change their behavior. So, behavior modification techniques work in many situations. Child behavior modification techniques include the use of both positive and negative reinforcements and positive and negative punishments. Parents can use a behavior modification plan to teach their children to have good habits and behavior. Classroom control becomes easier when a teacher knows how to use behavior modification techniques effectively. So, with this we come to the end of this session. Thank you very much for watching this video. Thanks a lot.